Hi, my name is Gascon Moreno. I'm the Vice President of Awareness and Operations at GAP, the Global Allergy and Airways Patient Platform, a patient organization umbrella that represents 200 patient organizations in respiratory and immunology. I'm from Barcelona, Spain, but I live in beautiful Vienna in Austria. For us, it's very important to always capacity build ourselves. Sometimes we think that we know everything, that programs like that prove us wrong. There is so much more to learn to affect policy change, not only in Europe, but abroad. And for us to take all of these opportunities that were kindly given to us, it's very important, not just for ourselves as a professionals in patient advocacy, but also for us to transmit the knowledge down the line to other advocates that they may not have the privilege to attend these trainings, or they don't have the capacity of the ability to travel. So it's important for us and for our community to take all these incredible opportunities. So one of the skills that I think I have developed during the program, and especially during this live session, is to have a better understanding on the EMA and HTA processes and pharmacovigilances. They also helped me to soften some of my positions towards the system, but at the same time reinforce my need for fight for a change in this system, to make sure the system is more patient inclusive, that the voice of the patient is represented fairly in every stage of the medical approval process in Europe and abroad. So one moment that stood up for me on the training, since I have the privilege to be sitting with people from other continents and people working outside of my pathology work scope, is to see people from other places outside of Europe learning about the processes in Europe and saying, I want to bring this to my country. I want my continent to be as standardized and to implement those protocols that Europe have. So I think this is a great launching pad for the future for other regions of the world to make sure they follow the steps and our learnings in Europe and our mistakes. I'm a patient of CRS with MP, chronic rhinosinusitis with nasal polyps. So I myself try to join a few clinical trials, but I face barriers. I live in Austria, even though my German is decent, is not good enough. Even though I think it's good enough to communicate with healthcare professionals, they will consider that it's not good enough. So they will take that decision from me, even if we have available tools, right, to translate a few of the difficult words that I may not know. So this is one barrier that I think it happened to me, but I think it will happen to many people that live in another country, especially in Europe, where we all have freedom of movement. Another thing, it was the intervention was never well explained to me. So for example, my intervention was to be hospitalized for 1 day just to have an endoscopy kind of trial, but and I was okay, but that was never explained to me in a way that encouraged me to, like, I'm gonna take 1 day off work to do this, and why do you need that kind of invasive test, right? So I think, and I work in patient advocacy, right? So if I extrapolate that to less empowered patients, right, or to the civil population, I can see that gets worse, right? So I think that is something that we have to change. And another thing is not happened to me, but it happens to my community a lot. We work with a lot of rare diseases like pulmonary hypertension, and regions where there is no access to care at all. There is no access to treatment. So some of those people join the trials because that's a way to get care, right? That is a way that you can get treatment, even if it's for a while. But then what happens after? That's also on their minds. Are they going to take the medicine away from me? Am I going to qualify for compassionate use of the medicine? So that is not very clear 100% upfront. So that's also that they also consider, because I will get well for 2 years, but after that I will go back to what I was before. So I think that, and probably that's just a communication gap. Probably that 100% they will get compassionate use if there is nothing else on the market, right? But it's not communicated well enough to encourage people from low middle income countries to step up and participate in trials. That's why most of the trials will still happen in the West, right, in the high income countries. So in Europe, first of all, language, I think that's always going to be a barrier in Europe, not only for clinical trials, but for advocacy in general. So that's something that we have to overcome somehow, especially with technology nowadays. Also, what the barrier that is a European barrier, but it's really a global barrier, is people living in cities. They are overrepresented in clinical trials, just because Europe is a very developed continent, but we still have a lot of rural areas, little towns with 20 people living with like 5 hours away from a hospital, right? That people is never represented in the trials because it's far, it's inconvenient. They may not know about it. They may not be as digitalized as people living in cities. So if that people is not represented in trials, that means that the development of the drug will be biased towards people who live in a better setting than versus people who live in a more remote setting. So I think that's a barrier that we also have to overcome. And again, this is education and information. So I think having better access to information will make me and people like me more comfortable in accessing trials. So having time to actually discuss with someone, it doesn't have to be the main personal investigator, right? It can be a healthcare professional, to sit down and see, okay, the trial is going to be like this. This is going to be the intervention. Just have time to discuss, and I understand, and what is going to be the burden on my life, and how many days of work I have to take. What can happen, right? What if I travel? What if I have to go in Europe, we're always moving around, right? So I think having that time, I know it's difficult because, having time with a healthcare professional is always money. So it's a difficult barrier, but I think that will facilitate people to have more confidence in joining trials, especially in the era of fake news and misinformation, right?